from Hawaii, and I'm excited. I know they're both on. There we go. Okay, so Kelly Key and Dr. Jonathan Slapkey are Francie and I heard them speak last month about their mental health program for athletes, and we were so impressed. We said, please, can you speak to the whole Coalition on Intercollegiate Athletics? So Kelly He is a sports therapy and eating disorder social worker who trained at UC Santa Barbara and University of Hawaii. And Dr. Jonathan Sladkey is a pediatrician and sports medicine physician who trained at William and Mary, Ohio. Oh, I think Ohio State, University of Ohio State for his MD, Emory for his residency, and then came to Hawaii for his fellowship in sports medicine, and luckily stayed. And so these two people have so much energy. It's amazing. He's our head team physician, and she is in charge of this program. And I'm just so impressed. I'm going to turn it over to you guys and tell us what you told Committee on Athletics last month, because it is awesome.
Thank you.
All yours.
Yeah, thank you guys for having us. John, you take the lead. I'm gonna share my screen so that you guys can see the presentation, hopefully.
You have to give her permission.
Great. You should have it. Here we go.
Let's see.
Make it full screen.
Yeah, sorry, 1 second. Of course, perfect time.
Maybe under view, or there should be a stop.
You say slideshow right there.
Oh, there we go.
All right.
All right.
All right, thank you guys for having us. So we wanted to talk a little bit about how we got to. Oh, can you guys hear me? Okay.
Yes, definitely.
We want to talk a little bit about how we got to where we are and what we've done with mental health. Especially given, we're not a Power 5 school, we're not in a Power 5 conference, and our resources at times are somewhat limited. And so we want to talk a little bit about how we got to where we are with mental health. So thanks for having us. You can go to the next slide, Kelly. We're just going to go through a little bit about where we came from and how we got there, and some of the things we're looking at with mental health. Go through some of what the NCAA says. So you can go to the next one. This really started back in 2019. I took the job in January 2019 as the head team physician. So it's only been a little over 4 years now. Kelly officially got hired fall of 2020, but she started working with us fall of 2019. So it's been a couple of years. When I took the job, we were using campus resources, which I think depending on your campus can be a really good thing. But basically, all of our mental health care came through our student counseling center. We had some collaboration, but essentially like any other referral, we're referring people to psychiatry the same way we're referring them to ENT or orthopedics. We don't have a university-based hospital. All of our referrals are community-based referrals. So there wasn't anything in place to really expedite or focus on the mental health care of the athletes. And when I took this job, it was one of the things that even during the interviews for the job was kind of highlighted as a key area that we needed to really develop and that we were lacking in the university system, and from what I understand, even my colleagues back at the Ohio State, the Ohio State University and Emory, Emory doesn't have a football team, and so it's a little different, but a lot of our docs there cover Georgia Tech, but this is not entirely unique to us. The counseling center at Ohio State also has like a 4 to 6 week wait period for students to get seen. It's just hard to serve a campus population with expedient mental health care. So the first thing we tried when I came on was we paid our campus counseling center to loan us some of their therapists to come down to athletics. And this was at least helpful in addressing the problem of expediency. It was really hard when, an athlete might be in season. The first therapy appointment for that athlete might be 4 weeks away. That might be after their championships, and this athlete is struggling and, needs to be out there on the field or wants to be able to continue to play and won't even be able to receive care until their season's over. So, this at least addressed that. It was a working solution for a bit, where the therapist would come down to athletics and see our athletes in our athletic department. We set up a little room for them. But there were still a lot of limitations. Our campus counseling center, out of respect for mental health privacy, is kind of a black box of information, but the way they're set up, they wouldn't communicate anything even to our team physicians about whether an athlete showed up, whether an athlete was even making their appointments, where they were at. If an athlete was suicidal, we had no idea. It was all handled within their system, but it made it a little bit difficult for us in trying to decide whether it was safe for an athlete to keep playing. How bad was their eating disorder? We just didn't get the feedback. So going into end of 2019, early 2020, we'd actually, before the pandemic began, it worked out really well, but we'd set up a partnership with Talkspace. It was kind of our next step along the way. It's an app-based mental health care platform where every athlete could have access at any time to a licensed psychologist. It was nice because it was broad and immediate access for our athletes. Obviously, there's some drawbacks. Our athletes would rather meet with someone in person. They would rather it be someone who understood athletics. There was no guarantee that these therapists understood what a college athlete would be going through. And we were still referring out to our community. But, there's a lot of drawbacks to this. The cost of individual referrals to a community provider adds up quickly. Our talk space was limited. So we made the next step eventually to, with Kelly, who we'll talk here in a bit about some of this too, but we ended up contracting with her to block off a portion of her community clinic so that she could see our athletes. So it's kind of like what we'd done with our student counseling center, except she was able to work directly with our doctors, was able to communicate more. We were able to develop release of information forms that would allow us to communicate, with the HIPAA privacy within the treating medical team. We were able to have a lot more communication. And from there, we were able to show, look, our athletes, we have 10, started maybe at like 8 hours, then went to 10, then went to 15. And we were able to show, look, our athletes are using all of these hours every week to see this therapist in her office. And when we looked at how much the outlay was for having our athletes go to the therapist's office, it made sense to try to bring her on as a part-time employee. So we ended up hiring Kelly first. It worked out really well to have Kelly because with her experience with athletics and the fact that Kelly was a Division I athlete, and the fact that our athletes had really had positive experiences when she was a community provider, it gave us a really good starting point. And then we kind of moved on this supply and demand model, this sort of proof of need model. We hired Kelly for essentially 20 hours as a part-time employee, and within a few weeks to 1 to 2 months, we had all of our hours filled every week. And we would have a short waiting list, maybe a week or two, still much better than campus services. But that helped us to justify hiring another therapist. And as we filled up her hours the next semester, we hired another one. So we've progressively every semester, we've hired another half-time therapist. And the more we hire our therapists and the more we advertise to our athletes the services that are out there and the benefits of it, the more the athletes have really jumped on board. So all 3 of our therapists are approaching pretty full schedules. We have 60 hours a week right now of therapy coverage from our 3 therapists. You can go to the next slide. So that's kind of how we got to where we are now, which is to be able to have 3 therapists. All 3 of our therapists have their master's degrees. We have Kelly's a licensed clinical social worker. Our other therapists have masters in therapy. One's, I think, marriage family. One's actually, we might not have marriage family, but they all have masters in therapy. And they all have experience with student athletes or being an athlete themselves. And what's coming down the pipeline for all NCAA universities with this transformation committee, and what they're looking at is that they're looking towards this requirement that there must be a direct pathway for full-time clinical services of a licensed mental health professional dedicated to serving the student athletes. And just as another sort of justification, I mean, we kind of got here ahead of this, which is really nice, but I think the NCAA is really recognizing this too. I think the language in this really makes sense. One of the reasons that we really ended up moving away from the campus counseling center, and one of the reasons we really focused on therapists who have been athletes, is that we had athletes who, and I'm not saying this is bad medicine, I think therapists are practicing what they know, but we had therapists telling our athletes that they needed to quit their sports because they were such large sources of anxiety and stress, and that they were directly contributing to their symptoms. And for a Division I athlete, it's rarely a reasonable approach to say, just walk away from your sport. So we really wanted mental health support that really understood what it was like to be a Division I athlete and to work within the confines of that. The other thing that we just recently were able to do, now that we have three halftime therapists, is we've created a mental health department within our athletic department. We call it Rainbow Wellness. We're the Rainbow Warriors. Sometimes we're just the Warriors in the Wahine, but we're leaning into the rainbow heritage with our wellness center. So we're the Rainbow Wellness Center, and we, for a long time, mental health at our institution worked the same way all other referrals do. If you needed to see an orthopedist, you had to come see one of our doctors to get a referral to an orthopedist. And that's how mental health worked for a while, is you'd have to come see one of our team physicians to get a referral to whatever community specialist we happened to be partnering with at that time. So we've opened up direct referral for all student athletes. So they directly just connect with the therapy department. And we've also opened it up directly to our coaches and our staff members. If they have something that they're concerned about, they can directly contact a therapist and talk to a therapist about what they're observing, how to approach it. So being able to have that's part of sort of the NCAA transformation committee too, is that direct access. And we've already seen it make it, the day that we announced to our athletes this ability to directly refer to a therapist, we had as you might expect, a handful of athletes immediately reach out to say, wow, this is available. I want to take use of this. So just to briefly go over, these are the NCAA's best practices. This is a little bit older. This is before the transformation committee stuff has really taken place, but the best practices, best practice number one is making sure that your mental health care is provided by someone who's properly trained and licensed. I think that only makes sense. We do have a hybrid model. So we have some of our therapists have their master's degree, but are pre-licensed, which is the period where they're still being supervised, right? Like in a medical field, this would be like our residency, where we have our medical license, we're able to practice medicine, but we're still supervised by someone. So that has allowed us to also expand our coverage by hiring therapists who need hours, but are still supervised by well-trained therapists, or in our case, supervised also by Kelly, to make sure that the medicine they're practicing is appropriate. Procedure number two, best practice number two, having the procedures in place for how you identify and refer student athletes. This has been really streamlined. Obviously, this is our emergency action plan and our non-emergency action plan. The best practice number three, the mental health screening, we put this into place even as we were hiring therapists, but it's taking on a whole nother level. When our physicians had to go and administer mental health screening, it was perfectly fine. We all do mental health screening in our primary care practices, and we've all trained in it. But to have a therapist who truly understands and specializes and dedicates their life to mental health, to have them involved in the screening process, it really changes the way we're able to address anything that comes up on these screenings. So, and then best practice number 4, this has kind of been one of the coolest things, I think, is that we are now moving towards, now that we have, the therapists on staff who are hired as staff members, having one of our therapists meet with each team each year. Usually we're going to try to do it going into their competitive season, just to address what the needs are. This best practice is trying to create a proactive environment that supports mental health. And so that's part of what we're trying to do with our resources is have our therapists be able to go and meet with each team proactively. Our therapists, in addition to individual care, are also able to, we had a team that had 3 knee injuries. All of them were season ending within about a 10 to 14 day span. It was 3 of their key players, 2 ACLs and another major knee injury. And our therapists were able to go meet with the team and talk about how do we adjust to what just happened to our team? How do we adjust to the loss of some key, how do we adjust to seeing our teammates having to go through surgery and rehab and how they're handling this. So that was just really nice to be able to have that as well. I think you can go to the next slide. I don't know. Do you want to talk through some of this stuff too, Kelly? I feel like I'm monopolizing this, but.
Sure. No, you sound great. I think this kind of feels like it's summing it up a little bit, but I think what we found, and I really kind of tip my hat to John, because I think him and his relationship with our AD was what really allowed us to do all of this, and both of their focus on mental health. But start small. Don't ask for the LSU football locker room, maybe start and ask for a helmet and then ask for some pads and really just kind of inch your way towards the things that you need. And Hawaii is one of these really interesting places where our resources are kind of limited. A lot of times we each have our own ethics where we're not supposed to be treating somebody, a family member, a friend, those kind of things. But in Hawaii, most people are family members or friends. And so a lot of these things get really hard in the community, and there's not very many resources out there. And so Talkspace turned into a really good idea because it expanded the resources. But I think with that, we were also able to see that, yes, it's helpful to have more, but it's also really helpful to have somebody who knows the culture, and not just the culture of the state of Hawaii, but the student athletes. So somebody who knows what it's like to be an athlete, or knows what it's like to participate in elite sports, or knows what just a lifestyle is. With that, we also found, I'm in a group of sports psychologists from San Diego, where I lived before. And so that was a community where I would get my information, get my resources, and then bring it back. And one of the things that was said to me was, this group, Holinsky's Hope, was also another thing that we could bring in. And they were focused on mental health. They were focused on suicide awareness, because it was all about their son Tyler, who had committed suicide at Washington State. Thank you. I was going to say Oregon State for some reason. And so that was something that we found, and we were able to reach out and just really resource and network. And that was really awesome. They came and did a talk, and we also were able to see how many schools they had started to connect with too. And so it really did feel kind of like a snowball, like in a really great way, a really positive way. And then, we kind of checked our facts and checked our homework, and NCAA was saying the same thing and kind of going along that same path that we were going. And so I think that was really, really useful and reinforcing and just really helpful.
And the Holinsky's Hope, I don't want to quote a cost, but it was not expensive. It was less than $5,000, I want to say, to have the Holinsky's come give a presentation. But the Holinsky's also maintain a whole host of resources about mental health. So from a perspective of a lot of bang for your buck, their presentation, I've never in my life seen this. I didn't see a single cell phone out the entire time they were talking to 500 student athletes. And we had student athletes wait in line for an hour after their presentation to hug them and talk to them. And I've, half the time when I talk to our student athletes, I see 50% cell phones. It was really powerful. But there's resources like that out there that aren't crazy expensive that can have a big impact. And the other cool thing about it is this ongoing support where they have ongoing resources for all kinds of mental health programming on campus. So cool resources like that are out there that don't require a huge upfront cost.
And to like add to that, one of the things that was really cool about Helinski's Hope is while we were trying to create some conversation and even like change in verbiage in the athletics department, this was also another supportive way because they have part of their entire talk is actually they do something called train the trainers, because the trainers are this like first responder of any of the student athletes, and they see them at the games, they see them at the practices when they're having panic attacks, and they see them daily pretty much. And so they were able to actually further that conversation of how to look out for symptoms or how to have conversations, how to do interventions. And so that was super helpful, I think, too. And I think this bigger picture that I saw was just really all of us doing this dance at the same time in the same way really helped us gather a lot of steam to push this along.
So some of my friends here are from Power 5 schools, and so this might not seem too impressive, but this is getting blood out of a rock. We are lucky if we celebrate if we break even on athletics for a year. So to build this up with nothing is like amazing. We do have a question from Eva, and Eva is from University of South Carolina. Do you tend to get requests or referrals for mental performance services?
Yeah, that was actually for mental performance. That was actually a note that I wanted to touch on. Typically, a lot of universities will require CMPC, which is your certified mental performance coach through ASP. And one of the things that John and I had talked about, like, do we want that as a requirement? And we kind of settled on, first of all, again, the kind of ruralness of Hawaii and how hard that is to find here. It's limited, not impossible. But the first thing we really wanted to offer to our athletes is mental health and mental wellness services so that we didn't limit them to only doing performance. Because it was pretty common that somebody would come, or even they would think that they were not allowed to come to us because we were only there for performance-based skills. So that's something that we've tried to make very clear with them, is like this idea of this continuum. Like, we can talk about mental wellness, mental health, and also, performance-based skills as well. And I think once we started to open that up, at least in specific sports, such as maybe swimming, tennis, baseball, very kind of like sports that take a lot of mental fitness. I've seen more requests for both typical therapy, talk therapy, as well as, hey, this happened during the game. Like, hey, I'm having panic attacks. Like, what can I do about this? And so it's often really naturally mixed in instead of separated, which has been really, in my perspective, it's been really awesome because I think we're serving more people that way. But yeah.
But yeah, we specifically dedicated our department to addressing basic mental health. And any performance is kind of either tied in with that. Some of the teams will hire mental performance coaches on their own for their team. We really, at least for now, wanted to make sure we address the basic needs and set that as our goal. But yeah, often it is really intertwined.
Thank you. This is Eva Monsma. Thank you for sharing that with us. And I'm glad to hear that you're talking about the CMPC credentialing, which I think is really important as we move forward, and athletics departments are expanding who they hire to do both, work at both ends of the spectrum. One of from my vantage point, I oversee a coaching education program that involves mental performance concentration. It's a master's level program. We're aligned.
Are you still there, Eva?
There's just like a, yeah, can you not hear me?
No, it just broke up for a sec. Keep going.
Oops, where'd I go? What part?
It was just like a couple seconds.
Okay, so yeah, we're just trying to get as many people aware of the psychological skills that often are relied upon or utilized rather in the clinical and the mental health side of the spectrum. And you know, my mission, I guess, from here on in and in where I'm at in my career is to just try to heighten awareness that like for coaches and athletes and athletic trainers, that you know, these psychological skills like mindfulness, goal setting, relaxation, imagery, they're all psychological skills that tend to be utilized in mental health interventions. Now, I know we're talking about recognition and, you know, getting awareness out there, and you know, it's a broader scope, but wouldn't it be great if, you know, as we were talking about learning motor skills in the earlier presentation regarding concussion.
Cut out again.
Yeah, we lost you. We lost you again on concussion.
Self-regulate our anxieties and be confident and motivated. But so these psychological skills, if we can teach them young or teach them early or make them mainstream, because we have good coaching education programs when we hire coaches in the first place, it will go a really far way to be truly the proactive side of things. You know, when we're kind of beyond the awareness, like, yeah, mental health matters. I think we kind of know that matter is minimum, to quote one of our students at University of South Carolina, Jay Ulrich, Urick rather, he coined that in response to George Floyd some years ago. But you know, mental health matters, and to get awareness out there, I think is great and important and necessary. But you know, I hope that it can be the minimum, and that we can actually teach the skills ahead of time, so that they can be utilized and perhaps buffer our athletes from mental health triggers.
Yeah, and I think that's why we say it's like so intertwined, because
Mhm.
one thing I would say about our therapists on staff is this isn't classical, you know, one style of private practice therapy. You know, it's not just CBT or not, you know, just ACT or psychodynamic. It's a really fluid mixture of providing that education, that prevention work, as well as your typical talk therapy. And I think you're so right, Eva, that one of the things that I think is really important is that we have our basic knowledge of, you know, coping mechanisms and, you know, coping strategies and mindfulness skills. But I think as therapists, especially, this is where it gets important, I think, to have their own therapists in the athletic department rather than in the CAPS or the main student counseling, is because we are aware and we know that we can use these skills for sports performance too. Like we can use wording and scenarios that they can both use outside of their sport or outside of their game as well as inside. And I think, you know, our future, hopefully, when the budget expands, like Kelly had said, like we're squeezing from a really dry hole sometimes, but when the budget expands, I think there is the hope for more of these CMPCs. Starting on the shoestring budget, it's really helpful to at least get people who can understand it and who can have the awareness, as like you said, as that starting point.
Yeah, I also seem to think that, you know, in the next 5 years or so, if we're ending up in a space where athletes are not being provided the services by their schools, but rather they're, you know, the capitalistic model changes and they're responsible for hiring their own staff. I think the service providers may be, available in bulk, rather, I don't know how else to explain it, but where there'll be more opportunities for people to enter the profession. And I know that doesn't sound right because it's like we don't have enough people to do the work as it is, but it's, as you're saying, limited by budget. But if we see some changes where profit sharing is happening and, this whole for paying for this stuff. So it'll be interesting to see, how that could potentially change. But we really don't know the future with NILs happening. But at any rate, I'm happy to hear that you're focusing on more of a holistic, within the holistic model of what we've been talking about today. So thanks so much.
Dr. Slatke, did you have more slides? Because I know we have some more questions here.
There's a few more, but we can take questions. I'm going to have to leave soon because I'm in the middle of covering our championship beach volleyball tournament. So I have to run back to that, but
Are we winning?
We play soon, which is why I have to go
Okay.
back. It's early now. But maybe we take questions now and then Kelly can cover anything else. We've covered most of what's in the slides.
Go ahead, Jerry.
So, hey there, Kelly and Jonathan. My name is Jerry Zemke. I'm an athletic trainer at the University of Alabama. And I really appreciate your insight into trying to build a program with, not maybe as much as you wish you would have, but you've put something together that will be valuable to your student athletes. And that's really all that matters. When you talk about existing infrastructure that would not be an additional associated cost, I'd like for you guys to talk about your what I would imagine would be your relationship that you have with your athletic trainers and how those are already embedded within the team and how you maybe operate. I'm glad to see that you guys allow for self-referrals by the student athletes, secondary to NCAA best practices recommendations. But, obviously there are going to be athletic trainers that recognize the need for a referral as well. And I was wondering if you could talk about how you include athletic trainers in your plan and the relationship that y'all have with them as we work to provide what's best for our student athletes.
Yeah, John, do you want to take this one? I can jump on board if you forget anything.
No, I mean, it's whenever we talk about this, I kind of relate to, when I worked in the hospital, the nurses were the front line who did the true star heroes who did everything for the patients to develop those relationships. And the same thing's true now that I've moved to this athletic based model. Athletic trainers are the ones who are there day in and day out with the athletes, observing things and really getting to know the athletes. This is a lot of where I think the proactive side of things goes. It's nice to have a really good campus counseling center that can deal with a lot of the mental health issues that come up, but that's not the same as having somebody who has been an athlete or is trained in athletic mental health care who's on campus who can work proactively. So we've, as Kelly kind of hit on before, we did this past year a Train the Trainers, where we had a couple of seminars working on preparing our athletic trainers for mental health complaints, any kind of issues that might come up. Kelly and our therapist work really closely with our athletic trainers. So I believe, you could correct me if I'm wrong, Kelly, I believe the athletic trainers were some of the ones who reached out and the coaches, but when we have had these major injuries on teams and the team as a whole is kind of struggling, athletics beyond even athletic trainers, like strength and conditioning staff, everyone who works with our athletes is part of this open referral process. So anyone can reach out, but as we do pre-participation screening and as we meet with every team at least once to go over mental health things, the athletic trainers are kind of an integral component in that as well. But we were trying to add that in proactively to make sure they're really trained. Athletic trainers are kind of asked to be a jack of all trades, right? You're not a mental health specialist, and yet a lot of times you're dealing with that acute panic attack in the middle of a track meet or whatever it is. So it's challenging position to be in at times. And we want to make sure we can support them however we can support them and provide the training and provide the resources to back them up whenever anything comes in. But no, you're exactly right. The athletic trainers are the ones in the middle of the fray, so to speak, front lines of the battle. So
Yeah, I think just to add to that, I know for me, coming from a background specifically with eating disorders, what I have always found was the hardest was the coaches were actually the hardest to break through, right? Like if you want change, that's going to be a huge barrier, unfortunately. And so one way that we kind of noticed that we can further continue the conversation was by first going towards the trainers, because the trainers wanted more help, they wanted more support. And so I think that we involved them actually first and foremost. One of my first meetings actually when I got hired was with the trainers to talk them through how I was here and how, I can support them. And interesting enough, we've actually had more trainers reach out to us to come and do presentations than coaches. So we rely a lot on the trainers. And I think what we did with the self-referral was, again, we wanted to be able to broaden the access, because a lot of times people were saying, well, what if I don't want my trainer to know that I'm coming, or what if my trainer, there's some limitations in what they think when I need help, or, there's just kind of a lot of stuff where we didn't want that to be a barrier. So we, while we accept self-referrals, of course, the trainers have still reached out to us, let us know when there's support needed, when they need support, how we can be proactive and come talk to the teams. And so I hope that we can just continue to collaborate more and more with them. I think we've even changed our wording on some of our forms, our consent forms, that includes the trainers as part of our treatment team, because that's absolutely what they are. They need to be informed in many areas of when an athlete is struggling with certain things.
yeah, that's actually the kind of other point that came up as you were talking in my mind, Kelly, is that, we are often very limited in what we're able to discuss with the coaches, depending on what an athlete is willing to release to the coaches. But as part of our core medical team, our athletic trainers are on the inner side of the privacy barrier, so to speak, and are part of our protected privacy. So we're often able to discuss, we're able to discuss a lot more in almost every case. And really, it's really useful to have that person who works so closely with them, who you can exchange information with.
Awesome. Thank you, guys.
Thank you.
Any other questions right here? Okay, go ahead. And whenever you have to leave, you have to go leave.
Yeah, I have
But
to
they better
ignore-
win. And everybody here is jealous of beach volleyball.
That is true.
It's not a bad way to spend a Friday morning, that's for sure.
Were there any questions? Because I think that was actually the last slide.
Any other beach volleyball here?
Carolina does.
Okay.
Oh. Next two lanes.
All right.
Pending the results of this tournament, Nationals is in Alabama, so we'll see if we'll be in Alabama in a couple weeks, hopefully, for beach volleyball.
Let me know if you need me. I'll be there.
All right, wonderful. No questions?
I just don't have a question, but I have kind of a comment. I like what they're talking about. Kelly, I'm a social worker, so I'm partly speaking to you here. We teach a course on compassion fatigue. And one of the things that we do in that course is we teach students how to do proactive self-care. With the idea that getting good self-care habits essentially inoculates you a little against compassion fatigue. And so when you were talking about some of the things you were doing, I was thinking about, teaching, because what we found is the students, we teach them things to do, that's part of the course. And the students report back to us that using that in their life already now helps them out with things like when something bad does happen. They are better able to take care of themselves. And so I was thinking, as you were talking about that doing that proactive self-care with athletes could have, similar, teaching them mindfulness, teaching them cognitive behavioral techniques, so that it's a tool that they have that then they can use that will, inoculate them in some ways or vaccinate them is a good way of kind of thinking about it. Where if something bad happens to them, it's, it's not that they're not going to feel the effects of it, but they're not going to be as bad.
Yeah, and I think this speaks to kind of our further considerations too. My experience as a social worker, I went to grad school about 10 years ago now, and as a social worker coming in, there's kind of this, at least in the program that I went to, it was like you either work with this, or with this. And I remember going in saying, well, I want to work with athletes, and I want to work in private practice. And people were like, oh no, that's not a field. Maybe you can figure that out, but that's not a field. And so part of our kind of further considerations is to be able to say, let's use practicum students to do a lot of these needs assessments. Also, let's talk to the athletes about that life after sport. That's a big deal that a lot of the conversation isn't always there. And how much it needs to be too, because there's so much that they need to prepare for. We also have a lot of international students. I think I have worked with over 12 different students of over 12 different countries just in a calendar year. And I do think that's something that's pretty unique to Hawaii, but it is also a really good training and learning opportunity for new therapists too, as we kind of broaden our scope to what mental health means to different cultures and what it looks like in different cultures, and what we would maybe diagnose for some and maybe not for others. And so I do think that there's a lot of future, both educationally for the people on staff, I think, being able to attend conferences like ASP or, get mindfulness skill training through, agencies like MPEAK and stuff like that. And there's also a lot, hopefully, future considerations more for the athletes themselves. And so hopefully we'll have that in store for us in the near future.
Wonderful. Any questions? Okay. Well, thank you so much.